Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning will continue on COVID-19 as we keep you up to date with what's happening and how it affects our community. It was a little over 4 months ago that the Centers for Disease Control and Prevention announced the first confirmed coronavirus case in the U.S. And Wisconsin Governor Tony Evers declared a public health emergency on March 12th, clearing the way for National Guard support. They have participated in a variety of efforts to support the state's response to COVID-19. And Captain Joe Trovato is the spokesperson for the Wisconsin National Guard. He's here to bring us up to date on those efforts. How are you, Captain?
I'm great. Thanks for having me on today.
Well, thank you for taking the time out to talk to us. I know this has been an extremely busy and not so easy time, especially for those of you who are on the front line. So there are teams of citizen soldiers and airmen that have helped establish mobile testing sites ranging from correctional facilities and health clinics to private businesses, as well as community-based testing sites. So if you would talk a little bit more about how that has come about and how things have been going.
Yeah, it's been an incredible effort. Honestly, we've established a number of different testing sites all across Wisconsin, and definitely have had a pretty heavy presence in the Milwaukee area as well. We started off back in March when the governor first authorized the mobilization of the National Guard to support the pandemic response with 3 specimen collection teams. Those teams really kind of refined their processes over time and really kind of established the blueprint, looking at what some other states had done as well, and really got a process in place. And then that request started to grow as the need for more testing became quickly apparent. And so we went from 3 teams up to 11 teams, then to 15 teams, and now we're operating with 25 different specimen collection teams all across the state of Wisconsin. In the Milwaukee area, we had 2 large community-based testing locations. That one was at the Midtown site on Capitol Drive, and that wrapped up just this past weekend. And then the UMass site on the south side of Milwaukee continues, and it's been an incredible turnout, really, at both locations. We've done as many as like 1,200 tests in a single day at each of the sites at its peak, and we're still doing just under 1,000 at the site on the south side. So it's really been incredible, and that's just that's only about half of our personnel that are mobilized are involved with specimen collection. We still have a number of other missions that are ongoing around the state, and we're also staffing even in Milwaukee, like the isolation facilities as well. So it's been an incredible effort, and it's been really a lot of dedication from our citizen soldiers and airmen.
Yeah, and we'll talk about those things in detail. It appears that we're in a very critical and fragile period because we are starting to reopen things, and we're still seeing those numbers grow, but we're not quite sure if there are higher numbers because of the increase in testing, or is it because this pandemic continues to grow. So we, like I said, are in that fragile period to kind of see where we go from here. But in the meantime, like you said, there has been increased testing all across the state, which has made a tremendous difference because you have individuals who have symptoms and others who don't. And so some of these sites don't require you to have symptoms in order to be tested. And then you have sites where you have to have 1 or more symptoms in order to be tested. So it's safe to say that there's something out there for everyone, especially those people who do not have insurance or don't have a primary care provider. You've got sites like UMOS, and then you mentioned Midtown, and that, of course, on Milwaukee's north side, that has been put on pause. We're not sure how long it's being put on pause, but we did hear from Milwaukee Health Commissioner Dr. Jeanette Kowalik that it is due to really being able to do that contact tracing and getting back to people. So in the meantime, Aurora is at that site, correct?
I know I'm not actually 100% sure who's currently staffing the site, but I know that the National Guard is not, and that's a local decision. All of these sites are locally run all across Wisconsin. That's one thing that is very important to us in the National Guard is that it is that everything in any kind of emergency response is locally run, and we're merely one of the tools in the toolkit, if you will, a resource that's available to local officials who request our assistance. And every community does it a little bit differently. As you mentioned, some communities it's by appointment, other communities it is by anybody can come whether they have symptoms or not, and that was the case in Milwaukee. So absolutely, we at this time we know that that site's at least been paused from a National Guard perspective, but we absolutely continue to see incredible throughput on the south side at the UMOS site.
Yeah, absolutely. And I'm sure I speak for a lot of people when I say thank you to all of you for the work that you've been putting in. And it's important to mention that there are a number of community health centers that are administering tests specifically for those who are uninsured. So the Wisconsin National Guard has been working at those sites and really taking the test. And then from there, what's the process after someone's tested?
Yeah, thanks for asking that. So we collect the specimen on site. It's a fairly simple process actually, but then once it's collected, they put it into a specimen collection bag, and then that's going to get transported off by our troops to a lab for analysis. Now, we're not involved with the analysis. Once we drop it at the lab, then our mission is really done at that point. And then the local health departments really take over at that point in terms of notifying folks. But that said, we also, one of our other missions is to staff a state call center as well. And the reason we set that up, we're working with the Department of Health Services and understanding that there's really a large volume of tests that the state and local health officials are trying to process, the labs are trying to process, and it's a challenge to be able to get back in touch with everybody. So we're staffing a state call center with some of our soldiers and airmen that are able to take some of that additional burden off of local health departments. So what they can't handle at the local level, we'll take some of that at the state level and then follow up with people. Right now, the follow-up time is anywhere from 5 to 7 days, sometimes as low as 3 days. It originally started off 3 to 5 days, but as the volume's grown, it has expanded a little bit. But usually 3 to 7 days is the notification time frame on negative or positive result.
Yeah, and like you said, this is no easy process by any means. The Wisconsin National Guard is community-based, as you've said, and reports to the governor unless it's called to protect U.S. domestic interests in times of conflict or natural disaster. As a member of the National Guard, what are your thoughts in witnessing this pandemic on the front lines? Because we've heard many times that very few people have seen anything like this since 1918.
Yeah, it's incredible from the Guard's perspective. It's unique, definitely. We have two missions in the National Guard. As you mentioned, we're the primary combat reserve for the Army and the Air Force during in our federal role where we could be deployed overseas and do our combat mission. But we also simultaneously, the other part of our core mission is to be available here in the state during times of emergency. And in most cases, most people think of the National Guard and they think of, at least domestically, responding in a natural disaster, in the wake of floods or tornadoes or something like that. But responding during a pandemic is definitely something new for us, but at the same time, serving our state, serving our civil authorities and our fellow citizens across Wisconsin is nothing new for us. That's what we're built for. It's frankly why many of us wear the uniform to begin with, because we want to serve our local communities, our state, our nation, and to be able to do it in our own home communities, whether that's Milwaukee or Superior or Green Bay or Monroe, Wisconsin. It doesn't get any better than that, because we see us as neighbors helping neighbors, and it's been a rewarding experience, truly has.
Wow, that's really special, because that's what it takes, that mentality to even put on a uniform such as yours. So again, thank you. You did mention that there's an alternative care facility and also some self-isolation facilities. Um, how has the Wisconsin National Guard been helping with those scenarios?
Yeah, so the alternate care facility, thankfully, hasn't had to been receive much use at this point. That's at the State Fair Park, and that was, really a state effort and a local effort with local government as well. And we had just a small part in the alternate care facility. We assisted with some warehouse operations there in terms of getting supplies over there to help set up. The Army Corps of Engineers helped retrofit the building to be able to take patients if needed. And now we have a very minimal footprint there, probably only like a half dozen people that are on site there, but we're able to flex if we need to provide a big group of temporary nursing assistants, for example, if that site was needed in more demand. And then the self-isolation facilities, there are 3 across Wisconsin, 2 in Milwaukee and 1 in Madison. And that's for folks who don't necessarily have a place or a living arrangement where it would be feasible to self-isolate on their own somewhere. So we're providing medical monitoring and administrative support at each of those facilities. One is run by Milwaukee government and one is run by state government, and for the 2 in Milwaukee. So, we've been there now for better part of over a month now, assisting staffing those facilities.
Yeah. So, as we wrap up, the funding for the Wisconsin National Guard to do what you're doing during this pandemic, not only in Milwaukee, but across the state, is being funded by the federal government right now. So several lawmakers, including Senator Tammy Baldwin and Representatives Ron Kind, Gwen Moore, and a few others, they've sent a letter to President Trump to request an extension of funding past late June. Do we know where we are as far as that's concerned?
Well, ultimately, those decisions are made at definitely a much higher level than the Wisconsin National Guard. But right now, you're absolutely right. We're receiving federal funding. It's called Title 32 funding. When we originally started back in March, we were on state active duty orders. And then on April 12th, we transitioned to this Title 32 federal funding, which means, again, that the federal government is paying for our services, but we remain under the command and control of the governor here in the state. So right now, we know that Governor Evers has submitted a letter to the president, along with a number of other governors across Wisconsin, and I know some other lawmakers have also reached out as well. And they're hoping to extend us through the end of July at a minimum for now. But right now, we're currently extended. We were recently extended to June 24th. So that is where we're currently at right now.
Yeah. So I know that your focal point and really you're just staying on course and taking care of the mission at hand. And like you said, all those other things you'll let someone else worry about. But thank you so much for not only your time today, but again, for all that you and the members of the Wisconsin National Guard have been doing. We thank you.
It's our honor to serve our communities, and we're grateful for all the support we've received. So thank you.
When we return to Our Issues Milwaukee, we are going to continue talking about COVID-19, and we're going to talk to a local author who has put together a book to help you better communicate with your children about the coronavirus. We'll do that right after this.